All right, so thank you for showing up for our panel today. My name is Amy Bowie, and I'm one of the subject librarians here at JPL. Well, not physically here at JPL, but with the UTSA Libraries and ITC. This is one of our Pizza+Research sessions that we used to have in person in the assembly room across the way from our suite, like where you could come and get pizza and listen. But of course, right now we're in a virtual format, so we've done this several times before, and it's always been a lot of fun. So hopefully everyone enjoys today's session. It's going to be a pretty much a casual discussion about the COVID vaccine and the vaccination process from a more of a public health perspective. And this is my co-host. I'm going to let her introduce herself.
Hi, good morning or good afternoon, everybody. My name is Diane Lopez. I am the librarian for architecture, construction and planning, and social work, demography, counseling, and other subjects. But we are excited to have this conversation with you guys. We're all going to learn a little bit more about the COVID vaccine from our two faculty members that we have. We have Dr. Erika Sosa and Dr. Clara Joyner, and I will go ahead and let them introduce themselves.
I'm Kara Joyner, and I'm the chair of the Department of Demography here.
Hi, I'm Erika Sosa, and I'm an associate professor in public health and the associate dean for research in the College for Health Community Policy.
All right, thank you, Dr. Joyner and Dr. Sosa. I'm going to go ahead and just read off our first question now. So both of you, like I heard both of you taught courses on COVID like this past semester in the fall, right? Could you talk a little bit about like how that process came about, like how you developed the course and like kind of why you decided to teach it? I guess we'll just start with you, Dr. Joyner.
Yeah, well, I was just fascinated because you know, we were bombarded with these statistics on COVID-19, and I teach demographic techniques, and I thought, wow, this is a great laboratory for understanding these methods that are widely used in public health and demography. And so the course, some of the things that we addressed is, you know, these various rates that you see on COVID-19, like case fatality rates and confirmed case rates and death rates. You know, how are they calculated? How do these rates differ by age and by race and ethnicity? You know, another issue is, you know, what is the influence of these policies like mask mandates on COVID rates? And what was really fun is, and this course was taught in the Honors College. And it was fun because we had the students work on these projects that looked at variation in outcomes related to COVID-19. So what was the spatial variation? So an example is one group looked at variation across states and counties and mask wearing. And what were the various factors that were influencing variation in mask wearing? And one of the big factors was the proportion of counties and states that voted for Trump in the 2016 election. So I think the course was great for kind of understanding, you know, the statistics that we see out there, and also just learning about, you know, methods that we use in epidemiology and demography.
Yeah, there's a lot there. Like Dr. Sosa, do you want to talk about your course and how you decided to come up with, like, I guess, the research topics that you and your students looked at?
Sure. So my course was a contact tracing course, and we started in fall 2020 and continued it into spring 2021. And we're going to continue to offer that course. But the reason it was developed was for several reasons. It served a couple of purposes. One, the university has their recovery approach, basically how we address COVID-19 here locally and how we mitigate the spread. And contact tracing is a really critical part of that comprehensive approach. Instead of looking elsewhere, we wanted to internally be able to do contact tracing to, one, expedite the process of letting people know that they may have been in contact with somebody who has COVID-19, but also to provide our students with hands-on experience to do contact tracing. So this course was offered to our public health undergraduate students. They were primarily juniors and seniors who enrolled in the fall. and they did contact tracing as their hands-on experience. So what that is, if you don't know, is if somebody comes into contact with somebody who has tested positive for COVID-19, then we want to reach out to them in a timely manner to inform that they might have been exposed to COVID-19, and then to really provide them with those next steps as far as testing and quarantining. And again, just really trying to stop the spread of COVID-19 among our Roadrunner family. So we were really active in the fall, making those calls and reaching out to people. This served as a really good substitute for our public health students as well, because they weren't able to do internships as the pandemic made everything go virtual. A lot of the face-to-face experiences went away, but this provided something that was really great for them as far as their resume and their skills go related to public health. But also it provided a really great service to the Roadrunner family. Again, anything we could do to help mitigate the spread. Their role was primarily contact tracing, but it was also being public health advocates. So they provided a lot of public health education and information to the individuals that they were reaching out to. So one thing we realized is we needed to connect people to resources. So as they're going through quarantining and spending a lot of time by themselves, especially college students, very social, we are providing links to different services that they could reach both within the university and externally. And so I think it provided a really good opportunity for us to provide that support to them and give our students some really great skills, and again, to provide a service to the Roadrunner family.
Yeah, I mean, that class sounds fantastic, like contact tracing and like just research. And, you know, I know that in your class, Dr. Joyner, your students did a little bit more of observation and field notes. Can you share with us on how that went throughout the course or throughout the semester for your students? Like, what were their field notes looking like?
Yeah, so this is another course that I taught. And actually, if you're interested in learning more about these courses that we're talking about there, and you type our names in COVID-19, you'll see several articles in UTSA that have been written about our courses, because we're just kind of touching the surface. But anyhow, you know, students were really into, you know, discussing COVID-19. And so this semester, I'm teaching an undergrad research methods in sociology. And so a theme is once again COVID-19. And so, for example, in this course, we're using COVID-19 as a lab for understanding qualitative methods. So an example would be participant observation or ethnographic work, and also in-depth interviewing. And so one of the assignments that I had students do was to pick a location, you know, a public space, and observe people. And this is post the lifting of the mask mandate in Texas. And I said to them, don't go anywhere that you normally wouldn't go. You know, I don't want you to put you at risk of getting COVID. But, you know, like roughly 60 students did this participant observation, and it was just fascinating. Because basically what they found is variation in mask wearing and social distancing, you know, according to location. So for example, one person went to the bakery that's across the street from UT Health, and there people were really compliant. You know, everybody was wearing a mask. Whereas if you went to, say, a bar or the Pearl, you know, and outdoors where it's a little bit fuzzier, there was less mask wearing. But one common theme was that there's a lot of incorrect mask wearing. So mask wearing that's like, you know, the mask is, you know, under the nose. You can see the nose, or it's hanging off the ear or something. And so it was really fascinating just to hear the gradations and how people wear their masks. And since then, you know, I've just been noticing, you know, some of these things too. And another thing that they found was is that people weren't physically distant from each other in these public settings. And so it was really interesting to hear their reactions on that. I also had them conduct an in-depth interview. Well, it actually was like a 10-minute interview, just because it takes so long to write up and transcribe these interviews. But they were interviewing someone they knew, and about the precautions that they took to prevent themselves from getting COVID, and how these precautions changed over time. And I won't go into the details about those, just because I said I'd protect their confidentiality. But those were kind of fascinating too. And some people mentioned people during the interviewing getting kind of emotional And that was something that I hadn't anticipated. You know, I anticipated that I would have given them resources to give people, but that was, you know, really fascinating. And I think students have really enjoyed just talking about COVID-19.
I mean, from the look in the chat, it looks like one of your students was like, this is a great assignment, which is always really great. I love to see that, you know. I think research is always one of the best ways to learn. And yeah, and so thank you for that reply. And thank you for allowing students to do that. For you, Dr. Sosa, like how did your class roll out, and especially with the with the introduction of the vaccine itself?
Right. So we've been, you know, we developed the class in the fall, and we worked really closely, I should have said this earlier, with the local health department, and to really complement and to make sure that we aligned with their efforts. But we also relied on a number of other resources as well. But you're right. So we were doing contact tracing and really focusing our efforts there, as well as the public health education piece. And that did shift. So we offered the class again in the spring, but as people are being vaccinated, it switches the conversation you have. There are differences when it comes to the quarantining recommendations and so forth. And what we realized was, as we were reaching out to these individuals, we were receiving a lot more questions about vaccines. So people aren't just wanting to know, okay, what do I need to do if I was exposed, but also, I don't want this to happen in the future. How do I protect myself? Can you tell me more information about this? So we really pivoted to broaden our scope to not just looking at contact tracing and exposure information, but also to really include information on vaccines, because there are a lot of questions about them, which I'm sure we'll get into today. But we wanted to make sure that we were providing accurate information to the many people we were reaching out to who start really demanding this type of information from us.
Yeah, I think like going by what like you and Dr. Joyner have said about your classes and the questions that came up amongst the students and also the survey participants, it seems, and just like from what we've observed in general, it seems like there's a lot of confusion just about the vaccine, like the COVID vaccine, and just vaccines in general. It seems like, just like, especially with all the stuff in the media, I keep on seeing headlines about how the CDC and everybody, like the scientists, keep changing their minds. and like it seems if we go bypass vaccines, like it's a part of the process, but it doesn't really get discussed that much, like publicly. So this is the first time almost in history where we're all following the development of this vaccine. So I was wondering if like you could kind of talk about like that, like the kind of the research process in general, and just like how vaccine rollouts like normally happen. Like, what does it mean to be federally approved, and why are there so many different vaccines?
I guess I'll start with the you know, how does it happen, and then Eric is going to talk about the different vaccines that are available. But basically, they go through a series of clinical trials in different phases. So roughly by the time, you know, for a vaccine to be approved by the FDA, it has to go through 3 to 4 stages. And these stages are sequential. You begin with a, you know, kind of a small number of, you know, healthy people, and you're interested in safety and effectiveness. You're also trying out different vaccines and different dosage levels. And then you move to a next phase, a phase 2, where you're trying to narrow the types of vaccines, and you're still interested in safety and effectiveness. And then level 3, you know, you've got even more people that you're testing it on, maybe not the healthiest people. So it goes through, you know, a series of, and each time it's being perfected, and it doesn't become federally approved until we're really confident about it. And so one of the concerns is about, you know, how fast this vaccination, these vaccines have been developed. And you know, we haven't cut any corners. We're just as rigorous as we would be in the past. It's just the process is happening much faster than it would. We're moving much faster just because of the urgency and the concern of COVID-19. And other people are free to, anybody in the audience, you know, who has expertise in this can elaborate too. But that's just a quick overview, and you can get on the web And also, there are all these websites on, like Johnson & Johnson and the different phases of the clinical trials.
Yeah, those are great points. And I think another reason it seems to have gone so much more quickly is there was a lot of funding put into the testing this time. There were a lot more resources concentrated. So we made a lot more progress in a short amount of time than you might generally see. And there are 3 different types of vaccines: the Pfizer, the Moderna, and the Johnson & Johnson. And for these vaccines, just very general overview, you need 2 shots of the Pfizer and the Moderna and 1 shot of the Johnson & Johnson. And all 3 are approved for adults, right? 18 and over, and Pfizer is 16 and over, 16 years old and over. And when you're fully vaccinated is 2 weeks after the last dose. So if we're talking about Pfizer, Moderna, it will be 2 weeks after your second dose. And if we're talking about Johnson & Johnson, it will be 2 weeks after that 1 single dose that you need to have. But you're not really considered fully vaccinated until then. So when we talk about efficacy and things like that, we're really talking about 2 weeks post the last final dose. I think that's an important distinction to make, because if you get the first dose of the Pfizer and don't go back to get the second, you're not fully vaccinated. So I think that's an important consideration.
I'm officially fully vaccinated today. And I've noticed too on Facebook, a lot of people that I know are posting stuff, right after their second shot saying, I'm fully vaccinated. And it's that 2-week period because your antibodies are still building up.
Sorry, I lost the mute button for a second. Yeah, like I've been seeing headlines about people not going back for their second shot. And so just to make it clear, like if they don't come back for their second shot, they're not fully vaccinated, right? Yeah,
that's right. And that is an issue of people not going back.
And Dr. Cosman mentioned don't post copies of your vaccination card on social media because people are photoshopping them.
Ooh.
And that is, yeah, I heard about that. I heard that there is there's a negative almost side effect of sharing your COVID vaccine card. And, kind of like thinking of that right there, like, I don't know if you guys know, it's like, what is the harm in doing that, in posting having that information out there? Is there like something that can happen or go wrong?
I think the biggest issue right now is fake documentation, like people basically stealing it and trying to, create it. And so just like there's fake, counterfeit money, counterfeit documentation, there are concerns about the vaccination records being falsified. And so there are efforts to try to make sure that doesn't happen. And when you're posting your information up there, it's easy for somebody to take that image and to manipulate it. So you don't want to be doing that.
We're getting a lot of comments in the chat about side effects. Do we want to go in, just discuss some of the potential side effects? I know there were concerns, people were saying that, I don't want to get vaccinated because people are getting flu-like symptoms, but that's just part of the vaccination process. Do we want to just kind of discuss some common side effects with the vaccine and whether or not they're worth the risk?
The common ones are, just kind of feeling junky afterwards, so feeling achy, tired, in some few cases you'll get a fever, but that's a good thing. That's telling you that your body is building up its immune system and its antibodies. There has been concern about some more severe reactions. And I don't want to talk too much on those, but those, when you do the numbers, like the one with the Johnson & Johnson, and that was the one with the blood clots. If you do the actual prevalence, the number crunching like the demographer would do, and you take into account the number of people that have experienced these things divided by the number of people that have taken these vaccines, there are really low probabilities or chances of having these severe reactions. And so you can, look at some websites on that, and they make, analogies to what are your chances of getting in a car wreck versus developing one of these adverse reactions, and you're much more likely to get in a car wreck. So I don't want to talk too much about the likelihood of those, but just say that they're more rare. And just want to see if there's anything too and other people are welcome to chime in on that too. Put some things in the chat.
And there's also, ways you can definitely talk to your doctor too, if you have the side effects, on how to take care of that, taking medicine, or, keeping a cold compress on you, working your arm out because there's a little bit of soreness that might happen at the spot of injection. So those type of things, I think most of them are mild, but they're not comfortable. Again, your body is, trying to fight and to prepare itself to fight off an infection. So they're not necessarily comfortable. And it just varies so much on who has the side effects. I was fortunate I didn't have side effects from either one, but it is sort of, there's no way to necessarily predict that. But I don't, again, like Dr. Joyner mentioned, I think it's also the numbers and sort of the risk assessment that you have to do too. It's very mild compared to if you don't get vaccinated and get sick.
Well, yeah, that's the alternative. Yeah, the risk of what happens if you don't get vaccinated. And there was something else I thought of, but I forgot it. And if you've had severe reactions to vaccines before, I think you want to talk with your doctor. If you've got any concerns, maybe talk to your doctor.
Oh, as you're mentioning right now, what happens if we don't get vaccinated, right? Like what would be the, is being vaccinated effective, or if you're not vaccinated, what does that mean for yourself and others around you?
Yeah, that's getting to a few issues like herd immunity and effectiveness. So maybe we could talk about effectiveness right now. And I think they found that Pfizer and Moderna are 95% effective. And so that's really high. And I think I saw on Atlantic Monthly, one way to think of these vaccines as an umbrella. and they protect you if you've got one of those windy storms with torrential rain. Maybe it helps to put on the boots and the rain jacket, and so that's kind of how I approach it. Is even though I feel psychologically different today, being fully vaccinated, I just want to protect myself as much as possible. So I continue to, put bacterial cleaner on my hands and wear the mask and that sort of thing. Because, when I think of the alternative of getting COVID, I don't have, I just don't know. I don't want to find out how I'm going to react to it. And I've got so much, we've all got so much stuff. A lot of you have jobs and full loads of classes. And so the idea of having to, or you've got, maybe you're living with a grandparent or someone who's immunocompromised. And so I just don't think it's, it's that risk cost benefit analysis. That's going to be the effectiveness. I don't know if you want to add anything, Erica, about this.
Yeah, so just like Dr. Joyner mentioned, 94, 95%, and that's after the 2 weeks after the second dose, right? And so, and Pfizer and Moderna have higher efficacy rates than the Johnson & Johnson right now.
That's right, and we also don't know about these other variants from Brazil and South Africa and Great Britain, about those. So there are some unknowns there. Another thing with effectiveness is we don't know how long we're protected, and we don't know, are we going to have to get a booster shot or something like that. And at a societal level, there's something called herd immunity. Which is referring to any kind of infectious disease. And that's when as a population, we develop resistance from it. And that's when, you know, around 90% of the population has been vaccinated, or they've had the infection, but still, I think there's some unknowns with COVID-19.
I just had a question about so the effectiveness of the vaccine. Like, I know the percentages vary depending on which vaccination you're getting, and people there were people saying that they don't want to get this vaccine versus that vaccine because of that. But from what I understand, previous vaccines, like before COVID, were actually less effective than these, right? So technically, even if you're getting a Johnson & Johnson shot, which was listed as having lower effectiveness, it would still be pretty good. It will prevent you from getting more severe symptoms, right, of COVID.
That's right.
Right. And so when we're talking effectiveness, there's also two different numbers we're looking at, right? So the likelihood of developing COVID or getting COVID, and the likelihood of having severe complications from it, hospitalization and that sort of thing, or death. And so we definitely know that they're effective in both ways, right? In lowering the risk of getting COVID, but definitely lowering the risk of hospitalization or death, and which is really, a big part of what we're trying to do.
That's a really good point.
It seems like in the chat, there's concerns about, someone mentioned that they heard people have died after getting the vaccine. I haven't heard that myself, but and there's also
I just looked at those numbers. Actually, I don't mean to, sorry to interrupt you.
No, go ahead.
I just looked at the numbers for Johnson & Johnson, and the most recent ones I found were 3 deaths. And again, think of the denominator of the number of people taking it. It's extremely rare event, and what I suppose 900 times more likely to be killed in a car accident or something like that. I haven't done the math myself, but
the number is really small, but also I think it's looking at kind of the groups that were early on in the vaccination process to the older adults, and being able to distinguish between correlation and causation, right? So if we have an older population that we see mortality, it's not necessarily that it's due to the vaccine. So there have to be evidence there to kind of have that. It's an association, right? Like dying post-vaccine doesn't mean it was because of the vaccine. So there needs to be scientific evidence to show that. And then again, to Dr. Joyner's point, it's such a small number too. So I don't think the evidence is there right now, but they will continue to monitor closely too. There are research studies constantly being done on this. Everybody's monitoring it very closely. So I also don't want to make it like, nobody's watching this. Everybody's watching this.
Yeah, and those are those later phases beyond the later stages of the clinical trials.
There's a question here that I think is very interesting. It's what, in your opinion, would be the best method to quell and address misinformation in the media surrounding the vaccine? And they mentioned panic in the media based on misinformation that gets reported about vaccines and side effects, potential side effects.
Yeah, I think misinformation is a really interesting thing, because research shows that people will believe things if they hear it consistently. So if you hear an inaccurate message again and again, you tend to believe it, even if it's inaccurate, right? And so I do think with social media and other outlets, there are a number of opinions that float around as fact, or misinterpretations of data, which happens a lot. And so I think the best way to address it is to find out where people are getting their information, and to try to use those same avenues to provide accurate, scientifically based information, right? And not with an agenda behind it, but with just information so people can make the best decision for themselves. And so I know that we're working on this a lot in the public health area, is really trying to target, because also certain populations are more prone to getting this misinformation, and they're more vulnerable to it, which unfortunately we're finding a lot is the lower socioeconomic status, minority, racial, and ethnic groups. The groups that are at highest risk for the complications and consequences of COVID-19 are also the ones that are getting misled by inaccurate information. So I think that we need to be very proactive on our side to spread, again, accurate information so people can make the best decision for themselves.
And one source to look at is the CDC, and you'll be provided a link to that information. in terms of COVID-19, the Centers for Disease Control.
Yeah, what I saw in the chat right now, which was interesting because you're kind of mentioning this right now, Erika or Dr. Sosa, is the aspect of misinformation, right? Which is such a, like, 2020 was, I think, the year of misinformation, disinformation, and we had a lot of it going on. And we're also, talking about like the news media, and someone in our chat asked the question is like, what would you say about articles? And of course, we don't know if they're talking about news articles or scholarly articles, but articles that are talking about that, people who are fully vaccinating still transmitting the virus.
Yeah, so there's still research being done on that, which, is about, how many people will get it after being vaccinated, but also how it can transmit it. So the number is much lower, the risk is lower, which is why you see the CDC recommendations following suit, where it's kind of like have to be less stringent after you're vaccinated, fully vaccinated 2 weeks prior to post. But there's going to need to be more research. And I'm going to take a step back to sort of a bigger issue here, which I think you hit on it earlier, was this whole research process that we go to. So research is not perfect. And I want to make this very clear, because I feel like there's a little bit of public skepticism when it comes to research, because you get one message and then a couple months later you get a different message. And I hear a lot of people say things like, oh, well, they don't know what they're doing, or like they're switching their mind, so I don't have to listen to them. But the way research works is that it's not based on one research study and we go with that finding and spread the news everywhere. It's a culmination of research that builds on top of previous research to where we refine and get the most accurate information possible. And so I think that's an important distinction, because any recommendations that have changed have been the product of this ongoing conversation of researchers trying their best to objectively evaluate the data and come up with these answers. And so I also say that as a caution that, 5 months down the road, some things may shift a little bit more, but it's not due to a lack of honesty or a lack of transparency on researchers' points. It's just we need more data, and we can't fast forward to have all the data and then come back and do something about a pandemic we're currently in. So I just wanted to speak to that as part of the larger issue and addressing mistrust in the research field.
Yeah, and keeping in mind that we've had in the US, I think over 500,000 deaths from COVID-19. So that's another thing to think about in terms of, the stuff that we hear about adverse events. And yeah, and if you go to the CDC website, you'll see the section on what we're still learning. And so they're very, honest and explicit about that. And they've got a list of, stuff that, like, for example, how long these vaccines can protect people, what's the duration of that.
So we have a question about how, like, right now we're getting the vaccines because of an emergency use authorization from the FDA. So what more will it take to get officially FDA approved? Like, do you know anything about like that process?
Well, that's the 3 to 4, I think, clinical trials to get it approved. And we've got, maybe I misunderstood that, we've got three vaccines in the US that are officially approved. What does it take? Yeah, it takes those clinical trials, those 3 to 4 phases of clinical trials before it will be officially approved. So there are, lots of ones that are in development that haven't been approved. These are like the winners. I don't know if that answers the question.
I wonder if they're basically saying like, what's the difference between getting the emergency approval versus like the official approval? Like, I actually don't know either. So
yeah, it's kind of finding that tipping point between, because we have a pandemic, right? People are dying. There's an emergency need for this vaccine. So it's finding the tipping point to where we have enough of a culmination of research knowledge that shows that there's benefits to this vaccine that outweigh the benefit risk ratio kind of tips, right? That you're at more risk of not having it than having it, right? And so that's where it has with the emergency use. Can I speak a little bit to if you get vaccinated and you come into contact with somebody who has COVID-19?
I wanted to ask that question with like the whole idea of like, what, like if we're vaccinated, do we still have to follow, what do we have to follow? Like, do we follow the quarantine stuff, or do we kind of like just coast it out and do whatever?
I wish the answer was yes, coast it out, but unfortunately it's not. And I think that's one thing also we're trying to really be proactive on the education, that I think some people think that we're all going to get vaccinated and everything's going to go back to normal, but unfortunately I don't think it will anytime soon. But the CDC is really clear on their recommendations for people after they get vaccinated. And again, it does provide you a lot more freedom than before, but it's not going to be throw the mask away and do whatever you want. So for example, if you do come into contact with somebody who has COVID-19, but you're already fully vaccinated, then you don't have to quarantine, assuming that you have no symptoms, then you don't have to do the 14-day quarantine, which is a huge thing by itself, because I think that is really tough for a lot of people to do. And so that's one of the ways that our outreach to people through contact tracing is changing now because of the vaccines.
Yeah, for me, there are symbolic issues of, going into a place where I know the person who's working at the cash register, like HEB, has to wear that mask on tightly all day. And so I think the least I can do is put my mask on, and yeah, sometimes it's fogging up my glasses. I'm having a little bit of difficulty breathing, but it's the least I can do for these people that basically, have to do it all day, regardless of my chances of and my being fully vaccinated. And another thing too, in terms of the vaccination, New York City just developed something, I didn't recall the name of it, but they have a pass that so to go to a Buffalo Bills game or whatever, you've got to have this pass that says that you're vaccinated, and they've got it in the system and that sort of thing. And I think other states might move to that. So we're going to have restrictions on our ability to go places that will depend on our documenting the fact that we've been vaccinated.
Speaking of that, those questions just came up in the chat about do we think places or businesses should require people to be vaccinated? They said, for example, some schools may require students to be vaccinated before going to in-person learning. And then most schools require vaccination records for childhood vaccines or international travel. When do you think the COVID vaccine will be implemented into these requirements? And it goes back into what we were talking about before this, about long-term changes due to the COVID vaccine, right? I feel like it's like what happened with 9/11, suddenly those security measures are now part of our process. And I think that's how it's going to be with this too.
Yeah, so there have been a lot of conversations about what kind of documentation will be required. I think that's going to be critical, or what's going to be mandated. I think that's a very controversial topic because obviously vaccines are not a new topic. This is not a COVID-19 new thing that's come up. People have very strong feelings for or against vaccines, and they have for several years. So it's very controversial. I don't have a very strong position on it, but I do think, again, as we transition to more of the population being vaccinated, and we saw really steady increase in the number of people getting vaccinated. I feel like now it's tapering off a bit as vaccine availability has met sort of the demand. A lot of people who wanted to get vaccinated have been vaccinated or will be vaccinated very shortly. So I think we're going to taper off a little bit. But again, I do think we need to educate people to make the best decision for themselves, because also it depends on your whole perspective of public health policy, which is a much bigger conversation that we can tackle right now. But it's always been an ongoing issue of autonomy and the common good, right? We want people to be able to make the best decisions for them and to lead their own lives, but we also want what's best for the population and for your decisions not to impede on other people's. And when we're talking about an infectious disease, that's about as big of a issue as possible. I mean, you're going to impact other people based on your own decisions. So we have to be held somewhat responsible to each other. So, like I said,
yeah, that's just interesting to look at the stats for, other countries like Korea that changed their behavior really fast, and now and China too, and now it's just not they're beyond herd immunity, and we're still seeing, actually, you sent me some documentation on that, surges in certain areas like the Pacific Northwest and in Michigan and that sort of thing, and it just feels like it's lingering on. But I have the stats here for the numbers vaccinated. So they have the percent that had one dose, and then they've got the percent that are fully vaccinated. I'm assuming they're defining that in terms of 2 doses. And for the group that can, the group that's 18 years of age or older, it's 54%, or over half of people, this is as of yesterday, have had 1 dose, and 38% have had 2 doses. So that's kind of where we are in terms of the vaccination.
Yeah, speaking of that, like about how other countries are doing, like I've been hearing about how India is going through like a gigantic, I think, second wave, like a huge surge, right? And I actually was listening to this BBC Science podcast the other day, and they were talking about how they believe part of that is due to the fact that they loosened up restrictions way too early. And even though there is a variant introduced, like they can't conclude the variant is the reason why the numbers surged. It's actually because they were allowing weddings and everything again. Like, do you think that could be possible for what's happening in the Pacific Northwest as well? Like maybe it like, and we looked at our own mask mandate. Like, is a mask mandate still necessary now? Like maybe we just have to all stay in, I guess, we still have to keep taking precautions a bit longer is what I'm getting from this. And I wonder if we could just talk about that a little bit.
And I looked at some of those studies when I was teaching that demography of COVID-19 course. And because you can look at specific countries that dealt with things different way, but then there's studies that have taken advantage of variation between counties and states in mask mandates and restrictions on mass gatherings, and found that that those things matter, that there's a significant difference in growth rates for places that lift some of these things, that they have a bigger growth rate, and so you can look at some of those studies. So there is a link between that.
And kind of like talking about that, like the aspect of like continuing or is, continuing to wear a mask, and having that mask mandate, where does that leave us with the aspect of like, should we be thinking that COVID's going to stay around, or, or should we be thinking about like the longevity of our vaccines? Like, how should we be approaching that? How should we be approaching COVID as a long-term aspect of a disease, or how should we be looking at it as like the vaccine itself? Like, is it going to become like the next flu where we get an annual vaccine, and stuff like that? Or is it going to be something that's recommended during a certain period of time?
That's a great question. And I don't know. I don't know what's going to happen in the future, but I do see us probably needing to continue to do these vaccinations to protect ourselves and to try to, again, get to some form of normalcy to where we're not continuously shut down, or we're not continuously coming into issues where things have to look the way that they did last year. So, yeah.
I'm just going through the chat to see if there are any questions that people wanted us to answer.
Yeah, and flu is down right now.
Yeah.
Because I think because of all this, hand stuff, hand sanitizers, mask wearing, flu is, regular flu is down.
No, I mean, and I think that's something like the aspect of, I feel like during this whole pandemic, washing our hands has become the most second nature thing for me to do. As soon as I come home, like as soon as I come home from doing anything, like the first thing I do is wash my hands. And and that was because I think at the beginning of COVID, there was a lot of talk about like, you have to wash your hands and for 20 seconds. And, because there was, communication out there that was talking about like the transmission rate between, or like how you're mentioning contact tracing, between objects and what we touch and, even our own touch to others.
Yeah, there was definitely, especially at the beginning, a big emphasis on hand washing and not touching our faces, which I think everybody was like, oh my God, I touch my face 10 times a day, right? And so I think just some of those are general public health recommendations, but they're things that sometimes it takes a pandemic to really put them up front in everybody's mind. And I saw a question in the chat about how public health students, and I think just, public health practitioners or concerned students really need to take an active part in educating their peers about COVID-19, the vaccines, and again, maybe using some of the same channels that are already used. And I'm not saying to get into a social media argument or a Twitter debate with random people, but at the same time, like we go to really informal sources for our health information, just in general, we do. Unfortunately, not everybody's calling up the physician or going to the CDC website for their information. And so I think it's really important to make sure that we're providing factual evidence-based information in those channels that people are already seeking information in. And really, as people ask questions, engage in the conversation. If somebody says that they heard something that you think is completely ridiculous, don't just shut it down as like, okay, you don't know what you're talking about, you're listening to something ridiculous. Use that as an opportunity for education, because that'll keep them engaging in the dialogue and really, again, spreading hopefully factual information instead of the misinformation that they've heard and just clung to because they heard it several times.
There's also information, if you go to the city of San Antonio, and I think you've got the link that you're going to share, questions about COVID-19. It's really easy to find information on where you can get vaccinated and schedule an appointment. So that's, that's helpful. They just have questions that are typically asked about that. And this point about, how are things going to change moving forward? Some of my students in their assignments would talk about remembering back to concerts where they were all jammed in there together and sweating and how they look back at that and they think it just seems really strange given, the physical distancing these days.
Yeah, I was watching a movie the other day and somebody blew out the candles on a cake and I was just like, ew. So it's completely different perception now. So.
No, I've done that with watching TV now. Anytime I see people, hugging or shaking their hands, I was like, oh, this was recorded pre-COVID, like, and you could tell. And yeah, it's just, it is really like it's just so we talk about it in such a pre and post kind of like value way.
Yeah, I was always a germaphobe, so now it's like everyone's behaving like me for however long. We did have a question here about, it's basically, I would say almost weighing like the costs of like staying shut down versus like going back to normal, and how like the economy is being affected and everything, and maybe it's more worth it to open up after all. I think well, it's like, I just want to say, like, if I think like when it was at its worst, like we were really straining the healthcare system, and I think we need to stop and consider, like, if it sucks that the economy shut down, but if we max out the hospital system and we can't admit people any further, that's going to be extremely disastrous. At least that's how I see it. But I don't know, like, what do you all think?
Yeah, no, that's absolutely right. And so it's basically a risk ratio, right? And that issue is really, it's challenging because there's not one clear-cut, super easy answer, right? There's a sacrifice on either side. So I do want to recognize that. But with that being said, I think it's one thing that makes a lot of the work we do so complicated, because if you look at like cost-benefit analysis that we do in public health, if we save X number of lives, what is the value of each of those lives? Like, there's not a dollar amount, like it's worth this much in the economy or something like that. And so I think it's really challenging, but again, it's public health safety and it's a pandemic. So it's something we're learning about at the same time. And as much as it would be nice to think that the economy didn't need to be shut down at all, we could have avoided all those sacrifices, the risk that we would have faced and the potential lives lost, I'm not sure would have been worth it. And so that's just an ongoing issue that I'm glad I'm not a politician. It is a very challenging decision to make, for sure.
Yeah, I hope you're able to get a lot of those questions. I mean, really good comments in the chat, and sometimes they're just streaming through and it's hard to see all of them.
No, I was gonna say, yeah, thank you participants, like our attendees. You guys are asking some amazing questions, and please continue asking questions throughout, in our last like 15 minutes, but
we're actually down 10 minutes.
10,
Yeah.
10 minutes. Oh, my time,
Yeah.
my time on my clock is wrong.
Yeah. Well, someone asked, like, if wasn't there a second strain? And like there are lots of strains and variants going around, right?
Yeah, and that is a concern about when we did clinical trials for these 3 vaccines, it wasn't, in the presence of these. Well, I think maybe the Johnson & Johnson has been conducted within the presence of these other strains. But yeah, that's an issue. Its effectiveness.
Right. So far, they seem to be effective against the other strains. But again, as new strains develop, that will have to be something research we'll have to find out here soon.
It looks like we have our question here, and I feel like maybe this would be our last question. Do you all have any thoughts about the U.S. or Western suppressing global vaccine equity via intellectual property laws, from profit motivating, buying up all the vaccines, et cetera? Do you guys have any thoughts on that question right there?
Can you repeat that?
Let's see. Amy, do you want to go ahead and say, because I feel like.
Yeah, no, I can read it. So do you all have any thoughts about the US/West suppressing global vaccine equity via intellectual property laws like blocked WTO waiver, biopharm profit motive, buying up all vaccines, etc.? And I have heard about, I know, just at least for the past few months, like I keep on hearing about how like we're not really, I thought we would all be working together in this vaccine since the whole world is going through it, but it seems like there's a lot of competition in terms of like business and everything. So
yeah, that's a difficult one to answer. What I've seen is this idea that companies might want to move forward with the vaccine for the sake of profit, but then there's that potential of, if something goes wrong, they're also thinking about that. And so I think that kind of puts a check on companies. Yeah, I don't know. How about you, Erica? Do you have an answer to that question?
I do not, sorry.
Yeah, that's a little bit out of, I mean, I remember the NPR podcast that I saw, address that issue, the global issue, but I don't remember too much about that.
Yeah, no, that was I mean, a great question, but yeah, I was even kind of like stumped on how would we answer that. But I think, due to time and, just respect for your time, Dr. Joyner and Dr. Sosa, I think we could maybe just repeat on the aspect of when will you be teaching your courses again? So if students, or your courses can be offered to just undergrads, or would this be offered also to graduate students if they're interested in kind of pursuing that, or expanding their knowledge and their base knowledge and their understanding? When will you guys be offering these courses again? Would you be offering them in the fall or in the summer?
So my contact tracing course is open to undergraduate health and public health majors, and it will be offered this fall again. So we just offered in the spring. We'll offer it again in the fall and hopefully the following spring. And I think it's a great opportunity to look at COVID-19 contact tracing. And also someone brought up in the chat, one of my students brought up in the chat, the many disparities underlying them that have been there for years that we need to address. We need to address systemic issues of inequity and things that have been happening.
Yeah, that was one of the things that we addressed in my class, is that the racial disparities in COVID-19 and how minority groups have much higher death rates. And yeah, in terms of my classes, I'm hoping to teach research methods in the future, and I think we'll continue to use COVID-19 examples.
And for graduate students, I teach a graduate epidemiology course, which of course we use COVID-19 in there. We examine that.
And of course, we got some students who are already wanting to sign up for your classes, and they're asking for the CRN number. And I don't know if you guys will have that to offer right now, but I would probably recommend one, looking at whether the future classes is going to be offered on UTSA, the class schedule, emailing Dr. Sosa and Dr. Joyner to get more information about when their classes are going to be held, and and just that information for registration. And yeah, so we're up on time. Thank you everybody for attending. The questions were amazing. The participation in the chat was great. And we are recording this, so we will be posting this soon up on the UTSA Library YouTube channel. And so we'll be sharing it out. And so this would be one of the best ways to share out the information through social media, like how we were mentioning earlier before, just getting that conversation out there, getting to talk to everybody about it. And then, always remember that we have our UTSA faculty who are persisting looking at this, and who are probably going to be one of our best sources of getting the accurate information about where is research going and how should we be preparing ourselves. But otherwise, thank you everybody for joining us and participating, and hopefully everybody stays dry. Of course, any last words, Dr. Joyner, Dr. Sosa, please?
Yeah, no, I was just going to say, feel free to contact us. If you've got any questions about our courses and what we're offering in the future, or research that you're interested in, we'd love to chat with you.
And I would just say, keep the conversation going and be critical users of research. Don't just depend on what somebody posts on social media, please, please, please.
All right, guys. Well, like I said, stay dry. I think it's raining outside. It sounds like it's raining outside my own door. And yeah, have a good day, everybody.
Yeah, thanks so much.
Thank you.
Thank you.